Always good to hear that music here on a Wednesday afternoon. That means it must be time for Helping Seniors of Brevard. And let's get things underway right now as we introduce the host of the program and also the executive director of Helping Seniors of Brevard, none other than Kerry Fink. Good afternoon, Kerry.
Hello, John Harper. It is always fun to be on the radio on Wednesday's lunch hour, and thank you, listener, for joining us here at 90.3 FM. We have a studio full, and we have a great show to talk with you about today. And you're really going to want to take notes on this because I think you're going to get a lot out of what we're going to talk about. So the topic that we're going to get into here in just a moment is getting good care at a nursing home. And you would think that would be an automatic thing, but there's probably some tips and techniques and thoughts and ideas we want to be aware of as we talk through this. And as you know, what a great moment for me to introduce our guest. We're going to get into the heart of this in a minute. First of all, she is our operations director for Helping Seniors. She joins us. Well, she doesn't join us. She was here when this whole organization got started. In fact, she helped Joe Steckler, our president and founder, get the Brevard Alzheimer's things running up. They call them Joe's Clubs to this day. And back in 2011, Joe formally introduced Helping Seniors of Brevard. And ever since then, we've been operating the county senior information helpline, helping more than 5,000 families absolutely free of charge during this time that we've been here. And Nancy Deardorff was, you were originally a board member, and then you actually stepped down from the board and said, I'll help you guys day to day. And 33 years registered nurse experience, and also heading up one of the area's largest and most respected home health care agencies. How are you today, Nancy?
I'm well. Good to be here, Kerry.
Yeah, this is going to be a fun conversation because our other expert in the house, I call him our expert. He is like he's like the go-to guy whenever we talk about anything elder law or anything related to that. I'm talking about board certified elder law attorney Bill Johnson. How are you today, Bill?
Good, Kerry. Good to see you.
So this was a great topic, and I want to can I back up a notch because I think all of us use the term nursing home very, very generically, right? You know, anytime we put a senior in any kind of an institution other than a hospital, we call it a nursing home. And I mean, I think most of us are confused even about like assisted living, things like that. And Bill, maybe we kind of start just there. When we say nursing home, how do you view it?
Well, nursing home would be a facility that is licensed as a skilled nursing facility.
Okay.
So it all depends on the licensure. So you have nursing homes, you have assisted living facilities, which have a separate licensure. And then that licensure is broken down on what kind of services they can provide. And obviously at a skilled nursing facility, they provide nursing services.
So as we go along in this conversation, we're really going to zoom in on that skilled nursing facility kind of designation. So when we say nursing home, as we're talking about this today, that's really what we're talking about.
Correct.
So Nancy, with that kind of in mind, I want to just kind of like if we could set the stage for this, because I think as we were talking about, so many people really have this idea that any place you stick somebody who's older is a nursing home. Like, for example, Friday, just this past Friday, 4th of July weekend, we're out at a place called Chateau Madeline. And they invited us out there because they were having this huge car show called the Red, White, and Blue Classic Car Show. And Bill Antonetz, who organizes all these fantastic car shows, he said, hey, why don't you guys bring out your Helping Seniors raffle car? So there we are with a beautiful brand new 2022 Dodge Challenger, courtesy of our friends up at Boniface Hires Dodge Chrysler Jeep up there in Cocoa. We're out there. We're having a great time with people, but I would not call that a nursing home because it looks like a luxury home. I don't know, Nancy, how would you, I mean, it's a whole different world, right?
Yes. Well, that's an example of an assisted living facility.
Right. And I think most of us, we don't, so we do a lot of work. For example, we host at the end of the last Monday of every month, we host a conversation that's open to the general public. We call it the Senior Resource Center of Brevard Community Information Series. And each month, at the end of the month, we're out there and they have a beautiful ballroom. They call it the Nautilus Ballroom. We invite the public in. They come in for a 1-hour seminar. This month, we're going to be talking about, ironically, what if you're living in a place that goes beyond your present home? So it's going to be talking about all these nuances. Not only is there a thing called assisted living, but there's actually a thing called independent living, which is just, it has some things available to you, but more or less, it's a senior-oriented lifestyle. And then if you need help, you can graduate into assisted living. And even there at Zon, I call it like a cruise ship on land. It's that luxurious. But they even have memory care if you find yourself needing to that. But again, what we're going to talk about today is really a skilled nursing facility. And Nancy, with your nursing background, talk about this for a minute, because I know we get a lot of calls. Somebody has just finished up a hospital stay, and maybe it was the first major hospital stay, and they're being told, you can't go home. You have to go someplace first for some rehab. Talk a little bit about what happens at the end of a hospital stay like that, and that'll set the stage for Bill to come in and bring in some things we should be thinking about.
Sure. Well, it's important to note, as Bill said, licensure is everything, how a place is licensed. And it's no wonder it's confusing. And I get a lot of calls from people that will say, I don't want my parent to go to a nursing home, but I'm thinking about long-term care placement. Mm-hmm. So in layman's terms, it all depends on licensure. In general, particularly in Brevard County, when you say nursing home, and you're talking about the physical building of a nursing home, it's kind of synonymous with skilled rehab. Mm-hmm. It's synonymous with a retirement home, old folks home. There's all sorts, skilled nursing facility, nursing home, all sort of the same. People use those terms meaning the same thing. And the reason is most skilled nursing facilities have two sides to them. They have one side where somebody would live there, and they call their clientele residents. Those are people that will live there probably for the rest of their lives. And then they have usually a separate unit for what we call rehab. And those are people that typically will maybe go from a hospital stay where they have to go in for inpatient rehab for extended rehabilitation. And they're called patients, and they're there for a limited period of time until they get strong enough to go home. But whether it's a patient or whether it's a resident, that building itself is still a skilled nursing facility. It just depends on why someone's there. So it can be temporary or it can be permanent placement. And yes, oftentimes folks, hospital stays are shorter than ever.
Right.
So it's very important for people not to be afraid of the word skilled nursing facility, nursing home. If it's because part of it is designed to take people who need that extended rehab. They're not intending to live there, but they need that extra rehab, physical therapy, occupational therapy, speech therapy maybe, as well as the skilled nursing to get strong enough to go home. And then even then, sometimes people will continue that therapy with in-home health care or outpatient therapy.
As you're talking about this, I was thinking about our own president and founder, Joe Steckler, because if you remember during the height of COVID, he'd had a surgery and it required him to then spend some time as a, I guess you would say he wasn't a resident, he was a patient at a skilled nursing facility. And Bill, this was back during the time when nobody, he's trying to conduct all the helping seniors business, and he and I are trying to do this by phone and occasionally by internet. And I couldn't, I had to go up there and hand him papers, but I couldn't go to him. I had to hand it in at the front desk, and it was a big, complicated thing. Bill, you must see a lot of this in the work that you do, and you probably learned a lot of things along the way.
Well, the reason we're talking about this today is because there is a big crisis going on at nursing homes on worker shortages. They're having a big problem finding people to work at nursing homes. So I thought it'd be appropriate to talk about how you could get good care at a nursing home to make sure that, during this period where they have a worker shortage, what you need to do to make sure that your loved one is taken care of.
Yeah, because I just remember it from my perspective as trying to help my mother. She was in a hospital and then said she's got to go have rehab. and they literally toss you this almost phone book size thing and say, here's all the skilled nursing facilities. Which one do you want her to go to? I'm like, you're asking me? I don't know. You know,
Well, that's a great segue into what I was going to talk about.
good.
Because usually it happens one of a couple different ways. So you have the hospital stay for whatever the reason, let's say a broken hip, and then now you have to go on to the nursing home for rehab. Well, if you have time on your side, you could look at these facilities, and you probably need to go out and visit them and to, evaluate them. And you're looking for, what ones are going to meet the needs and wants of your loved one, the medical needs especially, the emotional needs. Do they have interaction with other people? Where is the facility located? Is it convenient that people are going to visit? Are there any special memory loss issues that we have to address? Cost, obviously. Yeah. Do they have availability? How much space and availability? What are the payment arrangements? Are there any, do you need any special equipment, special amenities? Look at the room. How big are the rooms? Are you going to be in a private room? Are you going to be sharing a room? Is it a noisy place? Does it smell? All those kinds of things you should think of in looking at where the person's going to go. And so that's just, the short list. But, you want your loved one to be comfortable wherever they're going. There is a site, floridahealthfinder.gov, where they go through the different facilities that are available in your county, and then they give them a star system based on 1 to 5 stars, and how they rate, and they use a variety of different criteria, but how they deal with bed sores and things like that. And so they all get rated, and you can see which ones are the 5 stars and which ones are the 4 stars. But again, I think you really need to go to the facility and check it out. Now, that's all supposing you have time.
Right.
Because going and checking out 4 or 5 facilities could be a major undertaking, especially when the hospital's telling you, we need to get this person out of here tomorrow.
Right.
Right. So, if you have time, go look at the facilities, talk to the people that work there, find out if they can meet the needs, and then, go with the best one. You can, it also pays to go back and reevaluate. When you have somebody in there, did I really pick the best one? Make sure that your choice is there. Now, if you don't have time, because sometimes nursing homes are very crowded, and simply what they try to do is get the patient out of the hospital into whatever bed's available at whatever place, and whoever will take them first, whoever responds to the fax they send out first. If you don't have time, it would be a good idea to perhaps contact a geriatric case manager. Somebody who works in that field, who knows the facilities already, and then can take whatever ailment your loved one has and match it up to a facility that does a good job in taking care of them.
That's an interesting point. I was going to ask Nancy, because you've watched a lot of this from really the front lines when you were particularly day-to-day involved in managing healthcare, home healthcare, through the agency that you were running, but also you get a lot of calls about this very topic, don't you?
I do. And the first thing I recommend, and sadly, in most cases, people don't have the time to explore, like Bill is saying. And I absolutely would recommend that if there is time. A lot of people end up in a boat where they don't have that kind of time. Discharge planners in the hospital are busier than ever, so a lot of times it's not well explained. You do get a booklet here, here's your choice, pick one. And then the big question is there a bed available? So I educate people on the phone, and the first place I go to, and if they have computer access, I will walk them through it over the phone to go to that government website that shows the skilled nursing facility or nursing home compare.
Bill, that's the one that you were referencing. What was that site again? Do you have that handy?
That was.
Because it seems like it's a great resource if you know, and I guess like you said too, Nancy, if somebody doesn't have a computer, they'll call you and you'll look.
Yeah,
it up
I can walk them through
and help them because
I'm gonna while he's looking up that website, I'll talk with you here. It's important, and I do tell people this: don't go strictly by the star rating. You cannot go strictly by the star rating. I used to work in a nursing home, so I have some experience, and things have changed since way back then. But it's and we had the star rating in home health as well. People should know there is also a website to check home health compare. But when talking about a star rating of a facility, it's important you don't go, oh, there's 1 5-star. I want my mom or dad there, okay? Because that's not always the best. It might not always meet the specific needs of that person. So I always tell people, and this is just Nancy's opinion, look at 3, 4, and 5 stars. It's very difficult for a facility to earn a 5-star. Very difficult because the survey process is so particular. A 5-star indeed is difficult to achieve, but it also doesn't mean that is necessarily should be your number one pick. Like Bill said, you have to consider a lot of things. I start to get nervous when I see 1 and 2 stars. There's even facilities that have a 0-star, that have their star status taken away. Yeah. Bill, I think Bill has that website for us.
Yeah, it's floridahealthfinder.gov. And there also is another one, which is at medicare.gov/care-compare.
so
Yeah.
these
and
are,
if someone forgets that or didn't write that down, you can, if you have computer access, just Google nursing home compare Florida, and you will see the site.
or give Nancy a call at 321-473-7770, and she'll get you directed there. Another thing I wanted to ask you guys about that star system, because I also thought a challenge with surveys, right, is that's a snapshot in time, right? So they took this survey. I don't know how frequently they update the survey, but I remember, this is years back, but I remember when they handed me this thing that felt like a small phone book and said, here, where do you want your mom to go next? I'm like, I don't know. But it was kind of dog-eared. I think it was like a photocopy of a photocopy, and it had been sitting around the hospital for some period of time. And so the first thought I had is, well, this says 5 stars, but is it still 5 stars? Is that a fact?
That can be a fact. You really have to pay attention to see if they've had any management turnover or been bought out.
Right.
Because things can change dramatically overnight if you don't have that team in place that got the 5-star.
Well, I was thinking back to Bill.
That's such a good point, Bill. Longevity of management and staff.
Well, you know, I think it is important because we always talk about this on a couple of the assisted livings that are connected with helping seniors, that there's a longevity of staff there, and it means, number one, they know the facility, but they know their people, and it seems like all things considered, that's got to be a plus. But where I wanted to ask Bill a little bit about this is like, okay, so you're trying to figure this out. And that, you know, so these surveys, we don't know if they were taken in the middle of COVID, before COVID. I remember you and I had many conversations on the radio, and we also did Helping Seniors updates in the middle of the COVID with the lockdowns. And I remember all the nuances that had to put you through as an elder law attorney, because even though you guys were considered an essential business, because all this stuff has to keep going to work through the system for seniors, I remember you were having to jump through some really amazing hoops. You couldn't go into the facilities to get signatures or the things you need to do. So if these surveys are coming anywhere out of that time, and then as you talk about, even as things open up now, getting the right help in these places, it seems like you've got all these extra things to consider.
So one of the best ways to make sure your loved one gets care at a nursing home is to visit frequently. Okay, and during COVID, that was a problem.
Yeah.
People, some facilities, people were not allowed to even go in. Yeah. And then I can think of probably a half dozen cases where that really worked to the detriment of the patient. When they finally got the chance to go in, all of a sudden they found out their loved one had all these bed sores, and just because nobody was paying attention. And so going in and talking to the people and checking on your loved one is a big part about getting good care.
Yeah, so I guess if we're thinking about tips and ideas, so number one is we want to get ahead of the curve, and if we know mom's in the hospital and they're saying we're probably going to need to send her someplace else, maybe that's early on. That's the point that we should be starting to do this research. But number two, I think your other piece of advice, Bill, is when they're there, we got to make sure we're there, and because now I guess the restrictions generally are lifted, right? We can go in and see how mom or dad or uncle is doing.
Correct. They do allow for people to go in now. In some places, it's crazy because there doesn't seem to be any rhyme or reason. Some places you have to wear masks. Other places you don't.
Yeah.
Some places you can eat dinner in the dining room with your loved one. Other places, if you want to eat dinner with them, you have to sit outside. So there's a whole mishmash of things people are doing. But you are by law now entitled to go visit.
Well, I guess that makes it a big difference because I do remember when Joe was there and it was really in the height of all the lockdown stuff, and he was, it was really logistical. How do he had to sign something, it had to come back out, and it was all this, you had to plan 4 steps ahead. And I know that's a microcosm of what you went through in the elder law side of it.
That is true. That's true. We had to get signatures and get people to do applications, and very hard to get the signatures when you can't get in the building to witness it.
Yeah.
So.
Well, we're talking with board certified elder law attorney Bill Johnson and also Nancy Deardorff, who is in the studio with us. We're talking about this topic of getting good care at a nursing home. And we're going to continue this conversation on the other side of our mid-show break. And we're going to talk a little bit, too. We're going to get a word in about the Helping Seniors car raffle and the fun ahead with the Helping Seniors second annual Foundation Cruise coming up on Helping Seniors.
Hey, it's 12:33 right now here on the Talk to Me Network, home of the Information Overload Hour and Helping Seniors of Brevard. Let's get back to more of the program right now. An interesting conversation going on. Let's join host of the program, Kerry Fink. Kerry is also the Executive Director of Helping Seniors of Brevard. Hi, Kerry.
Hey, John Harper. And wow, we are having a really interesting conversation today on Helping Seniors Radio. We gather around the radio every Wednesday at 12 noon for the Helping Seniors Senior Information Radio Show right here on 90.3 FM WEJF. So hello to everybody listening online, too, at WEJF.net. And also to those of you who pick this up as a podcast later, whether it's Apple iTunes or Alexa podcasts through Amazon or Spotify or however you're getting us. We're just glad you're getting us. And thank you for making us part of this. Our job as a Florida 501c3, which is the fancy term for nonprofit, is we are here to serve you and to help educate, inform, and connect you to resources, as our president and founder Joe Steckler says, that will help you develop an aging plan, which we often kind of euphemistically call getting your ducks in a row, because we think information is power. One of the sayings that our guest, she's not guest, she's the co-host team, part of everything we do here at Helping Seniors, Operations Director Nancy Deardorff, 33 years registered nurse experience, also having come to us from having run one of the most respected top home health agencies here in Brevard. She's been a volunteer with Helping Seniors since the day Joe opened the doors and has been part of our team on staff, I guess, coming up on a year now.
November.
Yeah, well, thank you for all the good work. You've really done a great job. We're getting calls, record numbers of calls these days on the Senior Information Helpline. That free call for folks who are either seniors, concerned about loved ones who are seniors, or maybe it's a neighbor they're concerned about, but they're calling you at 321-473-7770 and asking for your help and guidance, and that's what you do. You get them connected.
I do. That's what we're here, and I want to thank you and Joe Steckler for letting me be a part of Helping Seniors. It's a very rewarding position, very sad sometimes. It can keep me up at night, but it's very rewarding, and we do help a lot of people.
Yeah, it's so important what you do, and thank you. You are such a blessing to the organization. Another person who is a huge blessing to this organization, he also goes back with Joe since before there was a Helping Seniors. He was helping Joe, I guess, in the day when Joe was with Brevard Alzheimer's, getting the Joe's Clubs organized, and has just been bedrock to everything we've been doing with Helping Seniors. I'm talking about board-certified elder law attorney Bill Johnson. Hello, welcome back.
Thank you for having me.
And the conversation, I wish we had been able to broadcast through the mid-show break. We're good because I keep learning. Every time I sit down with these guys, I learn something I didn't know. Our topic today, we're talking about, so we're going to try to recreate part of that, but our topic is getting good care at a nursing home. And if you remember, or if you didn't get a chance in the first part of the show, we were talking about that maybe you're just finishing up a hospital stay. They're telling you you're going to go to a skilled nursing facility for some kind of rehab for some period. Maybe it's weeks, maybe it's a couple of months, we don't know. But you need to pick one out. And they hand you this guide and they say, because we're the hospital, because I remember this very distinctly, we can't tell you who to pick. We are prohibited. You have to figure this one out on your own. So there you are. You're handed this book. You're trying to think of all these dynamics. What's close enough that I could actually visit my loved one in the facility? What is their rating? Because we this is what we got into. There is like a 5-star system, right? Is that
Yes.
And so 1 would mean this is really like at the low end of the totem pole. 5 means it would be the top of the top. But as we talked about, you could even find those that have no rating whatsoever, I guess because maybe they lost their rating. And what the conversation we got into mid-show break, which was pretty interesting, is I thought this was a survey of people who were, I wouldn't say guests, but who were visitors of the skilled nursing facility, and they were recounting their experience. And what you guys were explaining is, Nancy, nothing is farther from the truth about that. It sounded more like an audit than a survey.
It is an audit. It's a survey done by a group of individuals on behalf of the state and federal government. They do the state survey. Usually at the same time, they do the Medicare federal survey.
Uh-huh.
It determines ongoing licensure status. A facility can have their license removed if they fail a survey completely. And a survey can either be perfect, no deficiencies, which is very rare, or they can have different levels, if you will, of deficiencies. And it's usually a team of registered nurses, usually includes a pharmacist, a nutritionist or dietitian. So the people who come in to do the survey are like positions that the facility has. Okay. It's a team of like professionals that know the nursing home business, hopefully well. And they give you deficiencies, areas for improvement, if you will. And when they leave the building, they leave the report. They file that. That is on file. It's available to the public. You can see every single skilled nursing facilities on that same website Bill mentioned. You can see their last survey and where they were deficient. And then the facility has so many days or weeks to correct the problem and submit that plan of correction to the state. And many times the state, the survey folks will come back in the building. Sometimes they'll accept, depending on the level of deficiency, they'll accept the correction on paper.
What if that happened? I'm just asking this question. So let's say, I kind of, as we were talking about it, I got the impression this might be like a health inspector showing up at a restaurant, almost like, okay, we're going to see how you
Times
guys
100.
Yeah, we're asking you about all this, and wow, this isn't right. We're going to be back in 14 days, and you better have this fixed.
Mm-hmm.
So if somebody did the work and they got the thing fixed, does that reflect in their score? Well, I mean, would they
Yes.
get an updated score?
Yes, yeah. The survey will reflect the correction.
So one of the things that we were talking about during the break, Bill Johnson, elder law attorney, is that we were saying that the problem with a score is it's a snapshot, right? It's telling you what happened on that date, whatever that date was. And I would assume if you got a really great score, you might go, ha ha, look at me, and you might back off. But the reverse side is if you had an awful score, in the old days, they would say heads would roll. They're going to change management. They're going to change procedures. And it may be a whole different story very quickly after that.
Well, the first thing you need to know, because I looked it up during the break, is that the survey has to be done at least once every 15 months.
Okay.
So what you're looking at may be up to 15 months old.
Right.
Wow.
It could be something that happened easily last year. So that, as Nancy said, that shouldn't be the sole guiding light. You really need to go see how they react to,
Yes.
what your patient is going to need. I also looked up the 3 most common complaints, which is interesting. One is slow response time.
Yes, to the call bell.
Yep.
Sure.
So, and you can definitely test that while you're there. And social isolation, which we've had a whole lot of with COVID. And then the last one is the one that's always brought up,
Food.
and that's food. Yeah, exactly. Food.
Yeah. Oh, and I want to note the star rating is not directly related to the survey or the audit. Okay.
Wow.
Yeah.
So how do those two things interact?
The star rating comes from a document called an MDS, minimum data set, and it's a set of assessment criteria that residents have to undergo. A professional does it, usually an RN, upon entry to the facility, and then every 60 days.
Okay.
And so it compares one point in time to the other. So, for instance, did this resident have a bed sore in the last 60 days? Did this patient experience a unwitnessed or witnessed fall in the last 60 days? Those kinds of things. So the star rating is directly related. That is also on the website Bill gave. Directly related to the minimum data set, MDS, assessment criteria, and it compares 2 points in time.
You know, without using any names, we were talking anecdotally about a facility, not even in this county, but you were mentioning that you knew personally the person that was like the administrator and how particular they were, very ticky about making sure the facility was well run. And then it actually shocked you to go and see what their star ended up being. And then you started to dig into it and you saw one incident, really brought the whole.
Yeah, it really depends. The minimum data set assessment criteria, again, which you can see on that website, is lengthy. It encompasses the person as a whole. So it looks at activities of daily living, instrumental activities of daily living. It looks at falls. It looks at bed sores. It looks at everything, the person as a whole. And again, it compares that from 2 points of time. And it's important that you got to keep in mind that the data filled out on an MDS, minimum data set, is really, it's meant to be objective, but you also, which is why there's certified professionals in MDS, it's also in the eyes of the person who's completing the assessment. So it's very important that the person performing that assessment knows what they're doing and knows how to accurately answer those assessment points.
Yeah, and Bill, I was going to ask you, because as a person, anecdotally, you are in and out of a lot of facilities because the work that you have to do. You're meeting families, you're meeting the seniors. There's paperwork that has to be worked out and things like that. So I know your first piece of advice was start early, right? Number one, go ahead and look early. If you think you're going to be in one of these places, maybe go visit. And point number two, if your loved one is in one of these skilled nursing facilities, be sure you visit and look, see how they're doing. Is everything okay? What other things do you notice, Bill, as you're traveling around and you're meeting folks on location?
Well, the smell test is a big one.
Right.
When you walk in, some places you know right away there's problems just by the sheer smell.
Yeah, wow.
In the facility. I always look for how busy the staff is.
Yeah.
Are the staff in the rooms with the patients, or are they all just hanging out by the nursing station? That's one of the big ones.
Do you see staff?
Yeah. Sometimes.
Do you even see them?
Yeah.
Yeah.
Well, these are good points because one of the points that Bill brought up at the outset of the show is right. It's trickier now because it's not an easy job for these facilities to stay staffed. I mean, everybody is aware that finding good help can be a lot tougher than it was maybe pre-COVID.
Oh, absolutely. I couldn't agree with Bill more. It's the smell test for sure is one, but and you can't always go by the state-of-the-art building. It really all boils down to staff. And when you're looking at staff, there is the certified nursing assistants, the therapy staff, the nursing staff. Your therapy staff can be fantastic, A+ number one, but the really heart and soul, the blood running through the veins of a skilled nursing facility are its certified nursing assistants. So that's really something you need to take a look at. And a good facility, everybody should know, at least recognize the face of the administrator and the director of nursing. I'm sorry.
Wow.
If you don't know what that person looks like, if you haven't heard of their name, there's a problem. Maybe not if you're brand new, but a good facility is going to make sure you know who the administrator is and particularly the director of nursing is. You should recognize that person when he or she walks by.
Yeah, you brought up an acronym that I want to just take a minute and stop down and talk about, because I know we've talked about this a lot, how most of us who are outside the industry, we don't know a lot of the definitions. We started at the very start of the program saying, like, the problem for most of us is we lump everything into, quote, a nursing home, even if it's mom and dad are living in a luxury assisted living. Oh, they're in the old folks home. And what we're talking about specifically today is a skilled nursing facility. And so one of the people that works at a skilled nursing facility is a CNA. But Nancy, what is a CNA and why is that important?
Yeah, acronyms are a big thing, and we in the healthcare business forget that we use them all the time. For instance, a skilled nursing facility, in the business, you'll hear people say SNF.
Yeah.
SNF. Right. Oh, he went to a SNF, or he had a stay at a SNF. And, the average person would be going, what's a SNF?
Right.
CNA stands for Certified Nursing Assistant.
Okay.
And that is who they have to be certified through the state of Florida to work in a nursing home. That's the people who bathe your loved one, dress them, help them eat, help them get to. They're the heart and soul. They get them in that wheelchair. They get them to activities and events and social events, and then bring them back to their room. They serve them dinner, help them eat if they need that, get them something to drink, and oftentimes they're participating in activities because usually the activities director or life enrichment director, there's not enough of that person to go around. So the CNAs do everything, you name it, except for passing medication.
Yeah, that requires a nurse, right?
That requires a nurse, as does wound care.
Okay.
But your certified nursing assistants are the key to preventing a wound. They have for bedbound patients. They're the ones that turn the patients and recognize red spots and make sure that person is getting and reports that to the nurse that, hey, this person's getting a red spot, which could be the start of a wound. A wound, yeah.
Yeah, Bill.
So I just went on and brought up a nursing home out by my office, and their overall inspection was a 2 stars.
So that would say, like, whoa, stay away from that.
And quality of care, the subcategories that went into this 2-star, is a 1 star.
That's even bad to worse.
But
you have to look at what went into
that.
Right.
I think that's what Bill's getting at.
But on quality of life, 5 stars. Administration, 5 stars. Nutrition and hydration, 5 stars. Restraint abuse, 5 stars, meaning they don't do that. And there's some other categories that it just goes beyond the frame of my phone.
Yeah.
But just so that's kind of how they break it out, and they go and put into each of these categories, and then that is what goes into the overall score.
So that's very confusing. Like if I was a relative, I wouldn't know what to do with that score. First,
call me at Helping Seniors because let me tell you something else. So here's the thing, and the same holds true for home health, and I'm very passionate about this point. Okay, the sicker the patient, the more rehab, the more unbalanced, the more prone to falls that person is,
right,
the higher the likelihood that something's going to go wrong. Okay? Compromised immune system, they're going to maybe get an infection. Incontinent, they're going to get a urinary tract infection. History of a lot of falls, they're going to be high for falls. So think about it this way. This is not always the case, but this is why you can't look at something in a vacuum. The facility that has a heart that says, we'll take the sickest of your sick, we'll take that patient and we'll put them here in our nursing home. Maybe a facility with a lesser star rating to begin with when you look, because they're taking the sickest of the sick. If that makes any sense.
It does.
So, in a sense, and I'm not saying this is the case in every case. That's why you have to look into the details.
Yeah.
In a sense, if you have a 3-star, this is a made up example, but it could happen. Very realistic example. You could have a 3-star facility and a 5-star facility, and the 3-star facility gives better care overall than the 5-star based on the nature of the type of patients and residents they're taking in their doors.
Yeah, Bill, this is really to your point about why you got to check it out yourself.
Yeah, and what's peculiar about this particular facility that I pulled up is, for the most part, if you walked into it, you would not know there's anything wrong.
Correct.
Because they're scoring high on quality of life, administration, food and hydration. They score very high in a lot of categories. It's not till your patient's in there getting care, which is where you're going to find the deficiency.
Wow. We're kind of toward the wrapping up part of the show. We almost ought to have another show to follow up on this one, where we talk about what do you do if you discover you're in a place and the care is not meeting what you as the loved one, or maybe you as the person, are feeling like it should be. There must be some ways that
Can I add one thing?
Absolutely.
I'm so sorry. I know we're short on time. It's proven, scientifically proven, that patients in nursing homes, skilled nursing facility, whatever you want to call them, that receive visitors often get better care.
Wow.
Period. So visit your loved ones, your neighbors, whoever. Visit.
Right. Yeah. I would think so, and I think we have to. This is going to be a to be continued conversation. Bill Johnson, board certified elder law attorney. Before we get out of the show, I want to make sure people know how to reach your office, because while we've been talking about a topic that's very important for us to learn about, in the terms of getting your ducks in a row, and we have done. You did a whole series of articles. We've done so many television shows. We got to do some updated shows, but Bill, you really are like a go-to person when it comes to all the paperwork that somebody needs to have, particularly if you're going to wind up in a situation, where you might be extended stay in some kind of a skilled nursing facility. It brings up all those questions, power of attorney.
He was my brother-in-law's attorney, may I add.
Yeah. Mm-hmm. So healthcare surrogate, all the things that you've talked about so much. If somebody wants to get in touch with your office and say, listen, you guys are causing me to think, I need some help here, how do they reach you?
They can call us at 321-253-1667.
And you have a really good site. It's floridaelderlaw.net, right? Am I saying that right?
Yeah, and Kerry, I'm glad you brought that up, because I have a little book that you can download in a PDF function, and that book is the Florida Long-Term Care and Nursing Home Answer Book, and there are pages devoted on today's topic in that book.
Aha, and it's yours free, right? I mean,
you can just download it off the internet.
So floridaelderlaw.net. And this is the same. Is this the same thing that you publish in the Boomer Guide?
Yes.
Because that is a really excellent tool. I remember years ago when I first met you, Bill, it was at that time, I remember Joe was calling it the Orange Book, because it was actually a printed guide, and you've been able to really put it down to the essence of the essence, and now it comes in Boomer Guide, or you can get it right there at your website, floridaelderlaw.net.
Or call our office and we'll send you one.
And that number again?
321-253-1667.
Yes. Well, we're going to continue that conversation in future radio. Real quick before we're out of here for today, though, two things going on. It's our fundraiser. As helping seniors of Brevard, we can't do what we do without your help. The car raffle is in full swing. We're going to actually, Nancy and I were just talking, we're going to be out there at the Space Coast Cars and Coffee. That's a wonderful car show that they hold right there in Viera. It's going to be Sunday, 10 a.m. to 2 p.m. It looks like we're going to have the lovely 2022 Dodge Challenger out on site. Bill, I think you're like Team Mazda, though, right?
I think I am.
Well, I got to tell you, they've been giving us a lot of Dodge Challengers lately for events, and it's kind of growing. I mean, it's like, I know we have this whole rivalry. Jennifer Helen from Seniors Helping Seniors leads Team Dodge, and then Ashley Caswell with Hibiscus Court, she's led Team Chevy and Camaro, and so they kind of have this friendly rivalry going, but it's really picking up now. Because a lot of people like the Mazda, a lot of people like the Kia Sportage. In fact, last year's winner, David Odahowski, that's what he chose. He said, "I want the."
He needed an SUV. He needed the practical car.
And so that's how it goes. But you can't win it if you're not in it. So you got to get your ticket. You get your tickets at helpingseniors.carraffle.com, or you can call Nancy, right?
Yes, I can be reached at 321-473-7770. I can hook you up with tickets. And please remember, this is all a charitable donation. It's what keeps us going. Our thanks to AJ Hires and also Mark Pylock at the American Muscle Car Museum.
Yes.
This is our lifeblood. This is how we stay afloat and are able to continue to operate and fulfill our mission of improving the quality of life of seniors. All of your donations stay here in Brevard County, go directly to our seniors here in Brevard County, and we can't thank our sponsors like Bill Johnson, a longtime sponsor, and our donors enough. We really depend on you, and we thank you.
Yeah, and not only that, Bill, you're a ticket pickup point. You guys have tickets at your office.
We are. You can come by and get the raffle tickets right there.
Yeah, so however you do it, get your tickets. One for $25, $5 for $100 donation, and it's great fun. You could win your choice of a brand new car, but in all cases, you don't have to be present to win. But if you can be, you don't want to miss it. October 29th, Saturday evening, 6 p.m. to 9 p.m. Mark Pylock rolls out the red carpet there at his amazing facility, and they just welcome everybody in. It's a great fun night. They got beer, wine, soda. It's all included, and then on top of that, it's just fun because there's snacks and things and $100 million worth.
It's a fantastic evening. It's so much fun.
Yeah.
It's great for a date, believe it or not, or for the whole family. It is Brevard County's answer to the Hollywood red carpet.
Yeah.
It really is a nice evening.
It has become the automotive event of the year. So Saturday, October 29th. I got about 30 seconds to remind you, too. We're going cruising January 6th and or January 8th. You can come with us for a weekend, come with us for a week, or come with us for both. And there's information on that at the Helping Seniors Travel Club. We're going to reserve some time to talk more about that next Wednesday. So that's when you're going to be back to join us right here on 90.3 FM WEJF. Hope you have a great week till then. And on behalf of Joe Steckler and our team, we'll see you next week.